Imagine you've created a work of genius. It's an algorithm that could save thousands of lives. A neural network designed to optimize emergency room admissions, getting the most critical patients to a doctor in record time. You did it. You poured years of your life, countless sleepless nights, and every ounce of your talent into this code. You handed it over to OmniHealth, a healthcare tech giant, believing you were about to change the world for the better. The system goes live. Press releases are glowing, the stock price soars, and you're hailed as a visionary. But then, the reports start trickling in. It's whispers at first, then articles, then lawsuits, unexplained deaths. Patients with treatable conditions dying in waiting rooms. People who should have survived didn't. Your stomach churns. It can't be. Your algorithm was flawless. It was designed to prioritize need, to save lives, not to end them. You start digging. You pull up the public data, cross-referencing it with the outcomes. The numbers don't lie. There's a pattern, a horrifying, undeniable pattern. Patients with premium gold-plated insurance plans are getting whisked through the system. Patients on basic coverage, or worse, uninsured, are being pushed down the queue, regardless of their medical state. Your blood runs cold. Someone has tampered with your work. You log into OmniHealth's secure servers, trying to access the live code. Access denied. Your credentials have been revoked. Panic sets in. They know you're looking. Dum 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 dum. Initiating a brute force attack, a desperate attempt to tunnel back into your own creation. The screen is a blur of scrolling code, a digital blizzard. You need to see the source. You need to know what they did. Late into the night, fueled by coffee and dread, you finally break through, and there it is. Buried deep within the neural network's hidden layers, a few simple, elegant, and monstrous lines of code. A value-based modifier. It's not prioritizing medical urgency, it's prioritizing profitability. It's a cost-benefit analysis where the cost is a human life. Each patient is assigned a score based on their insurance provider's reimbursement rate. A broken leg with a platinum plan outranks a heart attack on a state-funded program. Your beautiful, life-saving algorithm has been twisted into a corporate executioner. The blood isn't just on their hands. It's written into the very logic of the machine you built. The horror is still fresh when the email arrives. A termination letter, effective immediately. Then another from the legal department. An injunction. You're being sued. They're blaming you. The media narrative shifts overnight. You're no longer the hero. You're the incompetent programmer whose faulty code is killing people. They're using your own creation as the murder weapon and framing you for the crime. You try to log into your work accounts, your social media, your cloud storage, where you kept your original backups. Everything is gone. Wiped clean. A digital ghost. They haven't just fired you. They've erased you. They think they've won. They think by silencing you, the truth will stay buried. But they underestimated you. They took your job, your reputation, your digital identity, but they can't take your knowledge. They can't erase the code that's now burned into your memory. They see you as a liability to be managed, a loose end to be tied up. You're about to find out you're not a loose end. You're the one who laid the foundation. You know every backdoor, every weakness, every secret path in the digital fortress they've built. They started a war for profits. You're about to turn it into a war for justice. You can't fight them in a courtroom. They own the judges, the lawyers, the narrative. Your only battlefield is the one you know best, the digital world. The plan is insane. It's a high-stakes data heist. You need to get the original code, the tampered code, and the internal communications that prove what they did. You need the smoking gun. This isn't just about clearing your name anymore. It's about every single person who died in a waiting room, while a less critical but more profitable patient took their place. It's for their families. It's for the truth. The first step is to build a new identity, a digital phantom that can move through their systems undetected. You work from burner laptops in public libraries, using anonymizing networks and encrypted channels. You're a ghost in the machine. You start small, probing their firewalls, mapping their network architecture. Every line of code you write is a step closer to their inner sanctum. It's a relentless montage of late nights and close calls. A security alert flashes you, kill the connection, pack up, and are gone in seconds. An anomaly is detected in server traffic you reroute through a proxy in another country. It's a high-wire act with no safety net. Finally, you find a vulnerability. A forgotten maintenance port in an older server, one they overlooked in their rush for expansion. It's your way in. The connection is fragile, the data transfer agonizingly slow. You watch the progress bar crawl across the screen, every percentage point a victory. You download everything. The CEO's internal emails, the ones where he talks about optimizing patient value streams and mitigating low-margin outcomes. The memos from the legal team discussing the acceptable risk of patient fatalities. And the code, the pristine original and the corrupted versions side by side. The evidence is irrefutable. Now for the final act. You can't just dump this on the internet. It needs to land with the force of a nuclear bomb. You package the data, encrypt it, send it to a handful of trusted investigative journalists you've been vetting for weeks. You attach a simple, anonymous message. OmniHealth is running an algorithm of death. Here's the proof. The password is profit over life. You hit send, and you wait. For a few hours, there's silence, the calm before the storm. Then the first headline breaks, then another, and another. It's an explosion. The story is everywhere. The stock market opens, and OmniHealth stock plummets into a death spiral. Federal investigators are storming their glass tower headquarters. The CEO, who just yesterday was on the cover of business magazines, is seen in handcuffs. Your narrative is no longer a victim's tragedy. It is transformed into a whistleblower's triumph. You didn't just reclaim your name. You exposed a truth that will force a global conversation about ethics and technology and corporate greed. They tried to erase you, but instead, you wrote yourself into history. The war isn't over. But the first decisive battle has been won. This is a reminder that even when the system seems impossibly powerful, a single, determined individual with the right skills and an unbreakable will to do what's right can still make it burn.